Ever wondered how common hip fractures are, especially among the elderly? You might be surprised to learn that they're rather prevalent. In fact, they're one of the most common injuries that older adults experience. It's a significant health concern that can drastically impact an individual's quality of life. Hip fractures typically occur as a result of a fall, often due to age-related changes like decreased muscle strength and balance issues. For some, a hip fracture can even be caused by something as simple as a sudden movement or twist. But it's not just the immediate pain and discomfort that pose a problem. The consequences of a hip fracture can be far-reaching, leading to reduced mobility, a loss of independence, and in severe cases, it can even be life-threatening. So you see, hip fractures are quite a significant health concern. But fear not, there's a lot we can do to understand, prevent, and treat them effectively. Stay tuned to learn more. Now, what causes these hip fractures? It's a question that's likely on your mind, and the answer is multifaceted. One of the most common causes of hip fractures is falling, especially sideways falls. This is often due to a loss of balance or slip on a wet or uneven surface. Next up, we have osteoporosis, a condition that weakens bones and makes them more susceptible to fractures. Osteoporosis is particularly common among older adults. Accidents, such as car crashes or severe falls, can also lead to hip fractures. These are often more severe and may require more complex treatment. Certain medical conditions can also increase the risk. For instance, those with endocrine disorders such as hyperparathyroidism or Cushing's syndrome are more prone to fractures due to weakened bone structure. So there you have it. As we age, our risk for hip fractures increases, especially if we have osteoporosis or a history of falls. Did you know that hip fracture surgery is one of the most common types of surgeries? It's true. Every year, countless people undergo this procedure, making it a routine part of hospital operations. Whether due to age-related bone weakening, accidents, or other health conditions, hip fractures are a common reason why many individuals find themselves in the operating room. Despite the potential risks and complications, these surgeries often provide the necessary relief and restoration of mobility. Indeed, hip fracture surgeries are quite common procedures in hospitals. There are two main types of surgery for a hip fracture. Internal fixation is the first type, where the surgeon uses screws, pins, or plates to hold the fractured bone together as it heals. The second type is hip replacement, where the damaged part or the entire hip joint is replaced with artificial components. Both have their unique benefits and potential complications. So, the type of surgery a patient needs depends on the location and severity of the fracture. Like all surgeries, hip fracture surgery comes with its own risks and complications. Let's delve into 3 facts about these potential hazards. First, infection is a serious concern. Even with the most sterile environments, there's always a small chance that bacteria may find their way into the surgical site, leading to an infection. This can delay healing and may require additional treatment. Second, we have the risk of blood clots. The process of surgery and the subsequent immobility can lead to the formation of clots in the veins of the leg. These clots can potentially travel to the lungs, causing a life-threatening condition known as pulmonary embolism. And finally, there's the possibility of changes in leg length. Despite the precision of modern surgical techniques, sometimes the operated leg may end up slightly shorter or longer than the other. This could lead to changes in the way you walk and balance. It's crucial to be aware of these potential risks before undergoing surgery. Rehabilitation after hip fracture surgery is a key part of recovery. Let's dive into 3 vital facts about post-surgery rehabilitation. Firstly, rehabilitation plays an essential role in regaining movement. After surgery, it's natural for our muscles to feel weak and our movements to be limited. A well-structured rehabilitation program, often involving physical therapy, helps to restore strength, flexibility, and balance. Secondly, rehabilitation significantly reduces pain. You see, as we strengthen our muscles and improve our mobility, we take the pressure off the hip joint. This helps to alleviate the discomfort associated with the healing process. And thirdly, rehabilitation is vital for preventing complications. It can help to avoid issues like blood clots, pressure sores, and pneumonia, which are risks associated with prolonged bed rest after surgery. In a nutshell, rehabilitation is a stepping stone towards reclaiming your life after a hip fracture surgery. Without proper rehabilitation, recovery from a hip fracture can be much more difficult. Surgery isn't the end of the journey. Lifestyle changes play a large role in recovery and preventing future fractures. Let's delve into 3 crucial areas. Firstly, diet. Nutrition is a cornerstone of recovery. A healthy diet rich in protein, calcium, and vitamin D aids in bone healing and overall strength. Secondly, exercise. While it may seem counterintuitive to move a healing hip, guided physical therapy is paramount. Low-impact exercises not only strengthen the hip but also improve balance, reducing the risk of falls. Lastly, fall prevention. Modifying your environment is key. Ensure your living space is clutter-free, well-lit, and equipped with aids such as handrails and non-slip mats. It's worth noting that these changes aren't temporary. Maintaining a healthy diet, regular exercise, and a safe environment are lifelong commitments that can drastically reduce the risk of future fractures. Remember, the road to recovery involves more than just surgery. Let's delve into some interesting statistics about hip fracture surgeries. Firstly, let's talk about success rates. The majority of hip fracture surgeries are successful, with around 90% of patients reporting improved mobility and less pain post-surgery. That's quite an encouraging statistic, isn't it? Moving on, hip fractures are unfortunately common, especially in the elderly. Studies show that 1 in 4 people over the age of 50 will experience a hip fracture in their lifetime. That's a quarter of the population over 50. Next, let's talk about the cost. In the United States, the average cost of a hip fracture surgery ranges between $40,000 to $50,000. That's a significant sum, underscoring the importance of preventive measures. Lastly, did you know that the need for hip fracture surgeries is expected to rise? By the year 2030, it's estimated that the annual number of hip fractures worldwide will reach 6.3 million. These statistics really put the impact of hip fractures into perspective. Medical science never stands still. There have been several advances in hip fracture surgery. Let's explore some of the recent developments. Fact 16 is the rise of minimally invasive techniques. Today, surgeons can perform hip surgeries through small incisions, reducing pain and recovery time for patients. Fact 17 revolves around enhanced imaging technologies. Surgeons now have clearer, more detailed images to guide their work, leading to more precise surgeries and better outcomes. Fact 18 is about improved anesthesia. Modern anesthetics are safer and more effective, allowing for quicker post-op recovery and less discomfort for the patient. And finally, fact 19 is about the development of better prosthetics. These artificial joints are designed to mimic the natural movement of the hip, improving the patient's quality of life after surgery. With these advances, the future of hip fracture surgery looks promising. So what have we learned today about hip fracture surgery? Well, we've discovered quite a bit. Let's go over the main points to etch them in our minds. We started by understanding that hip fracture surgery is indeed common, especially among the elderly, due to factors like osteoporosis and falls. We then delved into the 2 main types of surgery: partial hip replacement and total hip replacement. The choice between these depends on the fracture's location and severity, as well as the patient's overall health. Risks and complications associated with these surgeries were our next focus. While surgery is often a necessity, it's important to be aware of potential issues such as infection, blood clots, and hip dislocation. Our journey then took us to the importance of rehabilitation. We learned that the road to recovery doesn't end in the operating room, it's just the beginning. Rehabilitation is crucial to regain strength, mobility, and independence. We also highlighted some lifestyle changes that can aid recovery and prevent future fractures. These include healthy eating, regular exercise, and taking precautions to avoid falls. Our exploration then led us to some interesting statistics. For instance, we learned that over the age of 65, 1 in 4 people will experience a hip fracture. It's a stark reminder of how prevalent this issue is. Finally, we ventured into the advances in surgery. From improved anesthesia techniques to the use of modern implants and minimally invasive procedures, the field is constantly evolving to enhance patient outcomes. In essence, we've painted a comprehensive picture of hip fracture surgery, from its prevalence and types to the risks, rehabilitation process, lifestyle changes, interesting statistics, and recent advances. Remember, knowledge is power. By understanding these facts, we can better prepare for the possibility of hip fracture surgery, either for ourselves or our loved ones. Hip fractures might be common, but with the right knowledge and care, recovery is entirely possible. Stay informed, stay healthy.